And our next is our update on COVID-19 with Public Health Director Kathy McKay, and Jamie's here again with us this morning. Before you even get started, once again, what a tremendous job you folks are doing. From what we're hearing in the community, it's just really a job well done.
Thank you.
Yeah.
And that's from the team, because the team
Yes,
is
well, you
working
can,
hard on that.
yeah. That message to your whole group there.
Thanks, will do. So, good morning, Mr. Chair and Commissioners. I handed out the latest data report, and I think most notable is our active cases are down. They're at 46, so that's really good. We're seeing less cases, and the cumulative deaths are at 84. And our 14-day case rate is 21.34. That's really significantly lower than we've seen in months, so that's really good.
Right?
Pardon me?
That was over 100.
It was over 100, yes. So that's been really, the numbers are really looking great. So our cases reported per week are, you can see on the graph that they are still down, so that's good. The cumulative cases, the age ranges, obviously haven't changed from the last week. So we're still seeing the active cases right now, the 30 to 34 range is the highest. And cumulative overall is the 19 to 20 age range and 24 to 25. So those ranges are still about the same. Hospitalizations and ICU are remaining manageable across the state of Minnesota, but also in our hospitals and on the Fargo side as well. So that's everything is looking great. On the very last page, I added a page of the variants of the COVID-19. We have 3 different variant strains that they're following. The B117, the B135.1, and then the P1. So the 2 that are been evident in Minnesota is the P1 strain. We also have the B117 strain. So you can see the reported cases in the United States. Most of it is the B117. That's 1,173. That strain came from the UK, and so that one, it may be, they're studying all of these strains, and that's the most widespread, of course, across the states. As you see, 40 states are reporting that B117. And that one, the scientists are still, and again, they're studying all of these, but they're looking at if there's an increase in risk of death with these strains or increase in worsening illness. So this one is one that may be associated with increase in deaths. So there, again, studies continue. 17 cases of the B1.351. So 8 states reporting that, and then the P1, there's only 2 states reporting that P1. The P1 is from Brazil, and then the B1.351 is from South Africa. So just so you kind of have a sense of hearing about those 3 different strains that they're checking. They're saying that the B1.351, the Moderna vaccine, may be less effective in that strain, but again, they're still studying these strains, so we don't have all of the information, but there's some suggestion to that. More to come on the variant strains, but we have to be conscientious about continuing what we're doing, wearing our masks, staying 6 feet apart, avoiding crowds, et cetera, because of the strains that are circulating now, and they expect to see, there's some suggestion that we may, of course, see more increases in these strains as they're studying this and getting tested for it. So that is all I have. And
Kathy, I happen to, looking at your chart on active cases, it's nice to see that from ages 50 and over, there's eight active cases in Clay County. And there's actually none over the age of 69, which is really, I'm wondering if maybe that isn't part of the early start on vaccines with the elderly people.
I think so. Yeah, I think that's certainly been
So I mean,
helpful.
I think it's another encouraging sign that people should get the vaccine, because it appears to be working on those that have had the opportunity to get it. So I just want to point that out. It's an observation that probably makes sense, so,
Yeah.
okay.
Listen to your report, it sounds like you're talking about some airlines here, B117. But I had a question on the doses, the first dose and the second dose that you get. Is there a difference between them, or is it the same thing?
In terms of,
The power or whatever, because, I mean, when I went to get my second dose, they had a bunch of needles laying there, she just grabbed one, you know, and I don't think it said first or second on it, I don't know, is there a difference, or
it's the same vaccine.
it's the same vaccine, the same dose?
Correct.
Okay,
It just gives you, you get the partial immunity from the first dose, and then the more complete immunity after the second dose. Then that reaches that 95%. After the first dose, it's about 50%. But after the second dose, you get up to about 95% immunity.
she did a good job, I mean, I didn't even notice that I had a second one, I mean, it just, no problems at all.
Good. When you said you grabbed it, I was thinking you grabbed it and gave it to yourself. I was
Oh,
just
no.
going to question that.
Help yourself.
Kathy, on the variants, we're doing a lot of testing with the saliva tests. Does that have the capacity to identify variants, or are we tracking it through the saliva tests?
Yes, anything that goes up to the public health labs have the ability to test for the variants.
So would the vault tests that are being given here in the community would be looking for variants as well?
Yes, they would catch those variants, exactly right.
Good, thanks.
Okay, let Jamie talk about our vaccination process.
So looking at the data for vaccine administration in Minnesota through February 13th, Clay County, for people who have the total number of people that have had at least one dose, 10.5% of the population, and Minnesota-wide, 12.1%. So we fell behind this last week. And then the total number of people who've completed the series in Clay County, 4%, and statewide, 4.3% of the population. Looking at those age 50 to 64 with at least one dose, 14% in Clay County and 12.3% in Minnesota. And then people age 65 with at least one dose of the vaccine, 36% and 35% in Minnesota. And we have been focusing on the healthcare workers and those in the E12 and childcare. So that might be a reflection of those numbers that are higher in Minnesota, in Clay County. And then just to talk a little bit about what we are doing in Clay County Public Health. Last week, we had 600 doses, and of those, 200 were second doses. This week, we have 900 doses we're administering, and all of those are second doses. And then we have both Pfizer and Moderna. So we're doing second doses for the most part, but we have also requested we had requested additional doses if we receive them to finish up not to finish up, but to work on the E12 and childcare population. So we are not yet sure whether we will receive those, but we've requested those as well. So
Amy, how far along, what percentage of that group would you say is complete?
we had to do a survey to complete for doses that we were requesting for next week. And so we're estimating about 1,000 of that E12 and childcare to finish up in Clay County. And then we've got we're guessing, we have pretty solid data to back that up, about 300 people that are in healthcare and long-term care. And so we did request doses for those, but we also are doing 460 second doses next week. So the second doses and the first doses are continuing come on top of each other now, so we're looking at about 1,200 doses for next week that we're requesting.
I was at a Lakes Country cooperative meeting last week, and they deal a lot with school districts. And one of the things that they said is that they're getting a tremendous amount of positive, or teachers willing to to get the shot. I think that's good. I think they said there was one school district, I think, that 2 teachers that refused to take it. So
Yeah.
it's kind of encouraging too to see that that profession is understanding the need for that. So
Exactly.
Mr. Chair.
yes.
I've also heard from the early childhood educators in the area that the process here has been so smooth, and they're just so thankful for the work that you've done. Thank you for advocating for them to get those shots, and yeah, glowing reviews.
Thank you. The challenge is the time frame that we get the vaccine, and then to try to get that used up within the 72 hours. And we're also trying to do some accommodation for schools and other businesses that they don't want all their employees to potentially have that second dose because they're hearing about some symptoms from the second dose. And so we're trying to alternate those as well, so that we give them a couple of options as much as possible to register, so. And then as otherwise, the pharmacy retail program, has been in the news, and I have just done some checking, and basically they're saying to go online and register, and they will let you know when there's doses available. And Sanford and Essentia should be receiving vaccine doses as well, and so they're just encouraging people to wait until they reach out to you for that vaccine.
Do we know if the pharmacies in Clay County, like Walgreens and CVS, have they received any vaccines?
I don't know. They're discouraging us from calling. And so because of that, they're saying go on our website. If you go to the websites for them, it just basically says to register. You have to set up an account to register with them. I did call the Walmart pharmacy yesterday, and I was able to keep pushing buttons till I was able to talk to someone. And they said, you need to go to their website and register. And again, you have to set up an account to register with them. But when I asked, well, what about people who are not able to do that? They said that if you keep pushing buttons, you'll get to talk to a person.
I find it interesting that our public health departments can't know whether or not these facilities have vaccines or not. I think that's kind of astonishing, but that's not your fault. All right.
But they are overwhelmed with calls, and so I think that's an important thing to note, too, that people are calling and they're trying to divert people to the website and register, and then when vaccine's available, they'll be told. So,
But yeah, we would like to have those numbers. We hope to have all the numbers, and we haven't been able to get those in the past.
Well, to get a really good picture, you should really know that, shouldn't you?
yes.
Exactly.
Nice.
Kind of your
Yeah,
job.
exactly right. Yes, and then to know what the clinics are receiving as well, and we are getting information about that. So we're pushing to get the pharmacy information also, so.
Well, one thing I noticed, when you push something, you usually end up being successful, so.
I try not to be a pit bull, but maybe that's what they say.
With a smile.
All right.
Well, I think in order to reduce the calls that they're overwhelmed with, letting the local public health agency know so that they can advertise it on their behalf would be helpful as well.
Right, yeah.
I digress.
Yeah, well, it's just, a little common sense goes a long way, I guess. Anything else?
Okay, I think that.
Well, once again,
Yep,
thanks you
should
for
be
your
it.
report.
Thank you very much.
Thank you.
Good, there's good numbers.